And one of the things that we have done is that we have partnered with Chabot College, and we're looking to partner with Alani College as well in Fremont.
Awesome.
Because with the nursing program, unfortunately, a lot of hospitals and a lot of other places are not, they don't allow students in to do preceptorship.
Yeah.
So we said, hey, if this is our community, it's something that we need to be part of.
And it's outdoors.
And it's outdoors and everyone benefits. So we have tents at our different clinics, and which we provide flu vaccinations. Some of them are drive-through, some of them you can stop by. And then we have our COVID testing that we conduct right here. And then we have our wellness clinic. So again, we want to continue to keep our community healthy. So things like blood pressure, or things diabetes control that can from PHE to get the
How soon you can get a result?
So with COVID, we are actually the first clinic in our network that does the rapid testing.
Okay.
So we're doing both. We're doing both the PCR testing and the rapid testing. And so we can have your results as early as 15 minutes.
Oh, wow.
16 minutes?
Yeah,
Oh.
20 minutes. So for the non-PCR tests, so those are the rapid tests that we do. And we also do PCR tests. So we're the first clinic within our network to provide rapid testing for our patients. We also do contact tracing. So we have our contact tracers upstairs. And what that allows us to do, someone's positive, we immediately put them through the contact tracing process, so that if, for example, they're not able to shelter in place, there's a county stipend, the ART program that we provide, and then we connect them with that program as well.
Yeah.
Essentially a one-stop shop for our patients and their
It's
family
what
members.
people need, one stop. Yeah.
Exactly.
So you don't have to call over and
Right.
get through the phone.
Exactly, and that means that there's one less person in our community that could potentially get someone else, expose them to COVID.
Yeah.
So that's our goal: have a very smooth, streamlined process in working with our patients.
What do you do when what advice do you give when someone tests positive, but they're clearly not necessary, at least at this point, to go to a hospital? What do you advise them to do?
So if someone tests positive, we have a set of, essentially we have a handout that we give them, and they talk to a nurse, one of our providers. If there are patients, they immediately get a follow-up, but we ask them to shelter in place. And this is why we prefer the rapid test as well, because we're able to tell them right away.
Yeah.
But when we're not able to do that, if they're not able to get the results within those 72 hours, we tell them stay at home, because a lot of times, and this is the other key, I think, which led to a high risk rate of infections, is that you can be asymptomatic, you cannot have any symptoms, and still be positive.
Exactly.
So we tell them no matter what, no matter if you're feeling okay or not, it's best if you shelter in place.
Yeah.
But what's tricky is that a lot of our community members and patients live in a multi-generational household.
Yeah.
So it's, they could try their best, but that could also mean that their grandmother or their auntie or someone else within their household could become infected as well. So, so our staff is great. I mean, they've done everything from, cleaning supplies to diapers, so they don't have to go out. And again, we really try to do our best in getting everyone as protected.
Oh, that's great.
Yeah. So thank you. And as you can see, we have to change our masks as soon as we're done, our PPE. Dr. Fernales, our Chief Dental Officer, she has done an amazing job at, I've seen her literally inside with a child in a car, in a car seat, checking her teeth.
We did a lot of drive-through because a lot of our patients, kids by age of 3, they have a lot of cavities. And this has been so challenging for families, just taking care of themselves and taking care of kids. So we're doing drive-through with it. So we have tents set up. They walk through the drive-through, and I just go to the car and just see them and provide advice to them. Yeah, it's been challenging, but I think we still have a responsibility to take care of our community, and we hire from the community, and our staff are also affected by this, their families and their children. So it's been just challenging, but we're keeping it together the best we can.
So, can you describe a little bit more about what you do here? Is it like a clinic or like a hospital? What do you do here?
So we are a federally qualified health center.
Okay.
So what that means is that anyone can come through our clinics, and if you don't have insurance, we'll help you get insurance, but we don't turn anyone away. Anyone can get care at our clinics. We offer medical, behavioral health, dental, and programs that support them. So we have, for example, our Family Support Services program that serves kids 0 to 5 to provide additional services. We have school-based sites. So James Logan, for example, Hayward High, Chabot College are some of our school-based sites.
I see.
But anyone can come to our clinics if they get help, and we do enrollment as well. But as a federally qualified health center, we take pride in taking anyone that can come in, and we don't turn anyone away to be able to do that.
Now, there's a lot of like a emergency service center. Just kind of like that.
So we're not urgent care.
Oh, you're not
we're not
urgent
urgent care, but we do provide. So if you need a primary care doctor, for example, all primary care that we provide. We also provide optometry, podiatry. So it's like going to a doctor's office. That's very simply. That's where we're at. Where we have all the other services. Unfortunately, we don't offer urgent care, but we are open at our different clinics. Some of them are open 6 days a week. Most are open at least 5 days a week.
Okay. For example, I'm a senior, and also I had the Medicare coverage. So can I stop by here to?
You can come to our clinics. So we offer. There's different payers that we work with, or different insurances that we work with. We have Medi-Cal, Health Pack, Alameda Alliance, Blue Shield. So you're able to, as you were saying, as a senior, to come to our clinics and get care.
Okay.
We do that as well.
I didn't know that.
Right around the corner for you. You can come and we can definitely help you.
As I told you, I live in Hayward since 1978 to now. Long time, but I've never been here.
It's never too late. We're really glad to have you here.
Give me one of your car.
Yes, so let me I left them in my office. I'm going to go upstairs in a
Oh
second
yeah,
and go get a
definitely,
stamp.
definitely. Very good. Okay.
Actually, do you mind if I'm getting a stack of my cards? They're in my office. They should be in my little cubby at the top next to my computer.
That is our
Okay.
Yeah, there's two. Make sure there's a new one. Yeah, okay.
We have a patient and a
So yeah, so we can definitely help you here and anyone
Okay.
in your family member. We also have
Sure.
pediatrics,
Okay.
everything. We offer
Okay.
everything here, just not urgent care.
Okay. Okay. Understand.
Yeah, yeah.
Understand.